Hello, everybody, and welcome to another iconic episode of A Good Lawyer, part of the EIL network, Excellence in Lawyering. I am Esteban Stephen Garcia, your non-lawyer, coast-to-coast opinion host. Today, we're having a return guest for I'll just say, for subject matters that are kind of all over the news right now, unfortunately. But I think so many people, families, I'll say, that are also dealing with this on a daily basis. There was no one else I would have considered to have on to discuss this very intricate subject than this person that's joining us today. She is an expert in all of this. She is a world-renowned therapist that handles a lot of these cases. So we are looking to her today for some insight and some clarity. Ladies and gentlemen, please join me in welcoming back to the podcast, Lindsay DWYER-TONG. Lindsay, welcome back to A Good Lawyer.
Thank you so much for the kind intro, and I'm really glad to be here today and delve into this.
Yes. First of all, I want to get started by saying a happy heavenly birthday to Hayden Panettiere. Today would have been her birthday. She went to be with the Lord on Sunday, August 16th, 2026. There's a lot of speculation on things going on there as well. She, from what we can tell, there are no signs of trauma, foul play, or suspicious circumstances thus far. But while Hayden's family is grieving and investigators are still working to determine exactly what happened, do we have an honest conversation about her documented struggles without turning pieces of her life into a diagnosis or speculation into fact? How do we do that?
We need to look at the whole picture here. And let's look at the timeline of her life. And it's a sad timeline. She was a child actor. It's come to light what these child actors are going through and went through, and it's a lot of trauma. It's a whole lot of trauma.
She recently was on a podcast, a well-known podcast, and when she was discussing some of these traumas that she experienced as a young girl, it was a lot. And I think even the interviewer, who was very well known, I could see it in him that I think he saw that this person sitting in front of him was in some kind of mental distress, or I'll say it this way, that there was a lot of trauma there that she had been holding back or bottling up, and she was kind of letting it all come out.
So I want to start by saying, I didn't evaluate her. I know all the same information that the rest of us know that we're getting from the news and the internet. But I would agree with you. She came to a point where she was ready to share her truth and really face that trauma publicly. And I just want to say she is a phenomenal person for coming out publicly and sharing her struggles. These are really hard things to share, even in a therapy room with one person, let alone to come out and share it with millions of people.
Right. And this particular podcast, gentleman, who I truly do respect, has millions of followers. And when watching it, the part that really floored me, if you will, was when she looked over at him and said, she goes, "I've worked a lifetime to get to where I'm at. I've gone through a lot. Everything has been about getting me here to this place today, right? Everything." But she goes, I want you to remember this, though. She said, "Whenever you see these photos of me smiling and smiling for the camera, there's bright lights here and there, everything that looks amazing, right?" She goes, "I don't want you to believe a word of it, because none of it is real."
Right.
And that floored me because you could see she really meant that. And there was a lot behind that.
Oh, yeah. And I mean, that's for anyone that is true, that we have to go out in the world and mask. We have to mask what's happening to be successful in our lives and our careers. So undoubtedly that smile wasn't real. It was put on for her career, for her success. And behind the scenes, that's not what was going on. And masking in itself can be exhausting.
And I really wanted to preface, like I stated before, I wanted to just have an honest discussion about this because she also, that's now coming out, or maybe it was highly documented before, I just didn't know that, but she suffered from postpartum depression as well. And I think that was kind of ongoing for her. And I'm not an expert. You are. I don't know how long a condition like that would last, right? Does it go on forever? Do you deal with it once you have it? I don't know where it starts and where it ends, right? But I know she was a victim of that. And that's kind of what the topic, if you will, because it's much bigger than a topic. I think it's a real conversation about postpartum depression, but not only postpartum depression, layperson here again, but postpartum anxiety, postpartum insomnia. I've come to recently learn that these are real conditions.
Absolutely. Postpartum depression is debilitating. And for most women, for her to come out and speak publicly about it's just amazing because most women are ashamed to even admit that they're experiencing those symptoms. There's so much judgment that a mother could be experiencing, not bonding with their baby or having thoughts towards their baby.
And it happens more often than we know. Isn't that true?
It's very prevalent. So we have what's called the baby blues. We have clinical postpartum depression. And then if we want to look at a step further, which, 1 to 2 women out of 1,000 experience postpartum psychosis.
And while the media was really covering the story with Hayden, God bless her soul, there was another tragedy that was already in play. And that woman's name is Lindsay Clancy. And just learning about that was just, wow. I mean, a gut punch. How in the world, right? And for those of us that don't know, I'm thinking of this thing that is affecting so many lives. It's like a disease. Is it a disease or is it not a disease? Or is it labeled in your circles just a condition?
So the semantics on that, is it a disease? Is it a condition? From my point of view, let's look at the DSM. We put a label on these set of symptoms so we know how to treat them. So I'm hesitant to say, is it a disease? Is it a condition? But it's a set of symptoms that we need to look at and treat because it's something a woman is experiencing and causing significant distress to her daily life.
Some of the facts that I've learned, not speculation, but some of the facts that I've come to know, that she was a labor and delivery nurse, correct? At, I think the hospital was Mass General, as far as her career and what she dealt with.
Yes. And so as a mother-baby social worker, I was a mother-baby social worker for years. I can tell you that is not an easy job. It being with women during that point in their lives, it's exhausting, draining. I have seen these nurses cry with patients. I have seen them cry out of exhaustion. It is a tough job. It's, you would think, oh, it's so happy they're helping women have babies. No, they're helping women through really difficult childbirths. And that we can relate that back to Hayden, where hers was she had a significant blood loss, ended up needing a C-section. So they're helping through very difficult things, including infant deaths sometimes. and witnessing the pain and suffering of that. I've worked some infant death cases as a mother-baby social worker. And let me tell you, those are screams from a mother you will never forget.
I can imagine. All of this took place in a coastal town south of Boston. And I believe it's the town or city is Duxbury, Massachusetts. It was Cora, who was 5 years old, Dawson, who was 3 years old, and Callan, who was 8 years old. These are her children that she allegedly killed, right? We know that she did that. They're not arguing that she didn't kill them. I think what's going on here now is both sides, the state and her defense team, the state saying that she absolutely knew what she was doing. She even sent she sent her husband out on these foolish errands, so to speak, just to have him out of the house while she was going to do this. Now, you have, and listen to the defense side, where they're saying that she was a victim of postpartum anxiety, postpartum depression, and postpartum insomnia. Their defense also is that she also was suffering from an acute episode of postpartum psychosis and severe medication-induced mental impairment. There's a lot there, I know.
This is such a layered case. And, there's two pieces I want to talk about here. The first is this case is very difficult because it requires us to sit in the distress of cognitive dissonance, meaning we have to hold these two hard truths at the same time in the same space, that there were 3 children who lost their lives, 3 young, vulnerable victims who couldn't defend themselves, and that is very sad. In the same space, we also have a woman who was suffering from mental illness. And from what's been reported, it sounds like she was failed by the mental health system, which that could be a whole nother podcast on how, our healthcare system works in terms of mental health care. But
we'll take this as far as it goes. Trust me.
Holding those two truths within the same space is difficult when discussing this case. And we're seeing it. We've got people outside with, they're wearing the pink and they're Team Lindsay. And then we see the people who are demonizing this woman because, it's really hard to hold those truths. So we have to have a victim and a perpetrator. But it's not that simple.
It's not like the movies where you have a clean ending, right? I really want to touch on the medicine side of things, right? The pharmaceutical side of things. Now, there's a faction of people already that are wanting to go after the pharmaceutical companies that are the makers of certain drugs she was taking or being prescribed. Then there's the other faction of people, and by those, I mean lawyers, that want to go after her doctors or doctor that was prescribing her these medications. I guess the best of both worlds for these lawyers would be going after both. However, with the defense side of things, they're really focusing on the blame being on the medication. And obviously, she can't get this medicine without a doctor's prescription or prescriptions. So what say you on all of that?
This is a very long, complex answer here. We're seeing a lot of finger pointing, and it's not that simple. Doctors don't know how patients are going to respond to medications. You would think with all the advanced technology we would have a better system and more understanding. Right now, all we have is genetic testing that gives doctors a breakdown of what class of medications a patient may respond to best. But this still very much is trial and error. The drug companies are just producing a drug. It's the doctor's job to know what it treats and the side effects. But then we go back to what I just said, that the doctors don't know how a patient's going to respond. And it takes weeks for, a therapeutic dosage to build up in their system. So the doctor's not culpable here within a period of weeks.
Really?
That is my opinion, is that, if a doctor had seen over a long period of time that a medication wasn't working and didn't make any changes, or had she been reporting this isn't working, I think that would be a different story. But from the facts I'm seeing on the case, it doesn't appear that she took any of these medications for that long. There were, I believe, 13 prescribed medications. And it sounds like she was cycling through them, trying to figure out what would work for her.
And I know this is just an opinion, but that's a lot of medications, number one. Now, if you're trying to, as you put it, cycle through them to see what works, couldn't there be an interaction there somewhere with one or two of those?
I'm hesitant to speak on that. I'm not a pharmacist. I'm not an MD.
Right.
But
just
in
an
my
opinion.
Right.
Just an opinion.
In my experience, yes, all medications have side effects. Certain medications together have, certain interactions. But here's where the system failed her, is she went to multiple different places. And I'm sure that each one prescribed her different medications. Having worked in patient psych, it's not a good system. Every time you go in my experience, having worked in it myself and having clients go through it, you get a general diagnosis and typically a general set of meds that they prescribe every patient. In my experience, it is not individualized care.
Walk us through her walking through that upstairs window. Walk us through the mindset, if there is one. And that's kind of where I'm going with that. A situation where you think maybe the medicines were doing this. I know we talked a little bit about the amygdala last time around.
Right.
And where there's some trauma there. I don't know if postpartum is a part of that. It could be, I presume, but what's going on with the brain, the human brain? What's going on in her head? Obviously, we can't be in her head, but walk us through what you perceive happened.
So that's at the crux of this case, right? Is what was going on in her head. Was she completely culpable? Did she know what she was doing? Was this premeditated? So in forensic social work, what we look at is the interpretation of the evidence.
And what does that show you right now?
Right now, that shows me someone who, based off the facts that I've seen presented in the media, I see someone who is experiencing severe postpartum depression, who had insomnia, noticeable weight loss. She sought help multiple times. The witnesses we saw on the stand said she was struggling, and she let us know.
I don't know if you've had a chance to see the not emails, the text messages she was sending her mom, that I need you to come over right now because, paraphrasing, but I'm pretty close to what was said. She's telling her mom basically in a text, I something's wrong. I don't feel right. And I don't want to be alone with, I don't know if she said with the kids or just, she didn't want to be alone, period. Because these medications are really, again, paraphrasing, freaking her out. And she feels really bad.
So legally, they're looking at that as having an awareness and premeditating this, because she had an awareness that she wasn't okay. She Googled the symptoms. Clinically, I interpret that differently. I'm looking at someone who's scared, who's reaching out for help, who's intellectualizing these symptoms. So we see high performers when they're going through these types of issues. They want to understand what's going on with them. So they Google, they learn, and through that, it decreases anxiety because they feel like they have control if they can understand what's happening to them. So that's what I see. I see someone who is struggling, who knows they're struggling, and they're desperately trying to understand what's happening to them, reaching out for help. And as a therapist, that's what I would recommend to a client is who is your support system? When you're struggling, reach out to them.
So in everyday language, someone who is in serious psychological distress, who is, let's just say, repeatedly, we'll say, Googling on the internet, what do those behaviors look like for other folks to recognize if maybe someone they love is going through this? What are some signs that they can look for?
So this is where it gets difficult. Just because someone has the ability to do that, it does not mean that they are not in psychosis or that they're of sound state in mind or sound state in body. It's intellectualization. We see that in high performers all the time. They need to understand what's happening. But at the core of this is people in psychosis can walk through everyday tasks and speak like you and I, act like you and I, but we look at their core beliefs. Are they based in reality? So they may do all the things, their activities of daily living may look normal, but their core beliefs, the reasoning behind what they're doing is distorted.
And someone with your expertise, and you have a lot of expertise in this area, how do you give a jury the full clinical and human context of a situation like this that's going on without minimalizing the personal accountability for this person or the seriousness of what actually happened?
And that's a tough one, and always really important to stress. Understanding clinically why something happened does not remove accountability. Looking at this case, I see someone who was struggling from postpartum depression. And you had asked earlier, how does this, correlate back with trauma in the brain? Someone who has experienced trauma or prior mental illness is more likely to experience postpartum depression. So when I'm looking at that, I see someone who is struggling with trying to get a handle on this, has let people know she's struggling. She did all the right things. But at the end of the day, she still committed this act.
And that's what I think a lot of people are having a hard time wrapping their minds around. Do you agree?
Absolutely. And this is a really hard thing. It goes back to cognitive dissonance, is holding the reality that this is a woman that was sick, but this horrendous act that took the lives of 3 children also occurred.
And lawyers and clinicians can look at this very same case or cases and come away with 2 completely different interpretations of what's at hand here. What's your take on that?
I completely. And that's why forensic social work is so much needed in bringing mental health into the courtroom. The interpretations of these behaviors and the evidence are very different. And this case highlights that. So we look at the digital evidence they have. They're saying these searches are showing premeditation. As a clinician, I see searches that are showing someone who is scared. Someone who wants to understand what's happening to them, who wants to normalize their symptoms. And if they feel like they understand that, it helps. Once people feel like they understand their symptoms, it decreases anxiety. Because if you understand something, you can control it.
These were pretty specific searches. From your clinical perspective, what does it say about someone who is searching or looking up, Googling, however you want to call it, psychosis, hallucinations, suicide, psychiatric medication, etc., etc.? What does this actually tell us?
So the specific searches, Lindsay was well versed in these things. She was a nurse. She works with women who experience these things. The specific searches tell me she's educated in this.
How do you think the prosecution's looking at her?
The prosecution is seeing this clearly as premeditation. She knew exactly what she was doing, which then circles back to what was her reality at the time. Yes, she clearly had organized thinking in the searches, but what was her reality at the time?
I honestly, I mean, this is just my opinion, so no hate mail, please. I believe that a lot of, from what I've researched, we'll just call them the drugs that she was being given, have a lot to do with this. And, is there culpability with her? Maybe, but I don't know all the facts.
And that's the question.
That's where my head's at.
Yeah, and I mean, that's the question at the end of the day here, right? Is at the time of the crime, was she aware of her actions? And that's something that at the end of the day, only she knows. So we're coming in, looking at evidence. The prosecution is saying, yes, we're seeing organized thinking. She sent her husband out of the house. She clearly planned this. And that's completely possible. She planned that. But are we looking at a person who planned something, on a foundation of reality? She said later that she was hearing voices. And when we look at command hallucinations, the voices oftentimes will say, if you don't do this, this bad thing will happen. So yes, she planned and executed these things, but what was her reality? Why was she doing it? That's what we're asking, is the why.
And I know I've read on studies where insomnia, right? People not sleeping, meth addicts, whatever. Not saying that she was one, but I'm just saying, just the sleep deprivation can make you hallucinate. But if you're also going through something else, like postpartum depression or anxiety or what have you, you couple that with no sleep and all that. I mean, all kinds of things can conjure up in your mind.
Oh, absolutely. Lack of sleep and sleep deprivation alone can cause psychosis, let alone with everything else she had going on. This brings me back to something I read on the case, that in, I believe it was 2017 or 2018, she called for a welfare check while she was at work after seeing her daughter crying for 10 minutes and she's unable to reach her husband. That tells me that we're dealing with someone who is highly anxious, who needs to control situations to decrease anxiety. I mean, imagine to be in that much fear after 10 minutes that you call for a welfare check. That level of anxiety, it's a lot.
It's like someone who thinks they're having a heart attack.
Right.
Because of hypochondria or whatever.
Right. I mean, to go to that extreme, she's experiencing significant anxiety. And when we look at her anxiety, there's a lot of evidence to support that she was experiencing significant anxiety. Her specific instructions for the nannies, foods to be cut into 1-inch chunks so that the children don't choke. Their sleep routines have to be exactly this. Their feeding routines have to be exactly this. That tells me that she is someone who is in severe distress, worried that something is going to happen to her children, and doesn't trust other people to, take care of them the way she would. So she's doing everything she can. She's writing instructions, she's telling people, and that decreases her anxiety by doing those things. But I'm just seeing on the whole someone who was experiencing extreme anxiety. And when we think about someone who's in that anxious of a state, they're in fight or flight mode all the time. They're not thinking clearly they don't have access to their executive functioning center fully. They are in fight or flight, in survival mode, thinking from that place.
So that happened in 17, correct?
2017 or 2018, I believe.
And my Columbo brain I found it interesting, I'll say it that way, that this crime or incident, we'll say, right? This incident happened on January 24th, 2023, the date of the incident, right? I don't know why I thought this was a much newer case. Why did it take so long for it to get to trial?
That is a really good question. And I had the same question is, we're out 4 years at this point. I wish I had an answer for that. I'm not sure. But
I didn't know if you knew of something that maybe I didn't. Maybe I was missing something.
No, I had the exact same question. And when we look at our justice system, we're supposed to have the right to a speedy trial. This did not seem speedy at all.
Especially for this, horrible tragedy, I'll call it. I keep wanting to call it a criminal offense, but I don't know that.
And that comes back to what we talked about in the first episode, the first time you had me on, is our propensity to say this is a criminal sitting in front of us. This is a criminal offense. But that's putting her into the worst thing she ever did in her life. Mm-hmm. Looking at her at that one moment versus seeing the totality of who she is as a human being in the rest of her life.
Do you think, and I'm just asking, do you think that if she really did do this on purpose, we'll say, and was fully aware of what she was doing and her actions, how would one be able to live with themselves? I mean, every time you close your eyes, you're going to see your kids, right? I don't see how anyone could ever get sleep, number one, because as soon as you lay your head down, I'm thinking these, not in a bad way, the faces of her kids would haunt her for the rest of her life. I mean, how does, where's the mentality of, that's what makes it real difficult for me to think that a mother could do that. Especially, I don't know if she choked all three of them out, but she choked one of them out from what I heard. And that, that's that every time I heard or saw that, as far as what they were saying, man, that was a punch in my stomach.
That's a very personal, violent way to take someone's life. And you're absolutely right. She's going to live with that every day for the rest of her life.
If
over time,
it might. Purpose.
Over time, her emotional response to it might not be as strong. But I'm thinking back to the Andrea Yates case. Right. I listened to an interview with her recently, and she said there isn't a day that goes by that she doesn't think about her kids and deeply regret what happened, even though she wasn't of sound, she was very mentally ill at the time.
Do you believe that?
I do. And here's the thing that, unless you're a clinician, you don't realize is that mental illness is not linear. We can have ups and downs. We can see a client in front of us one day who is oriented, who is thinking their thought process is linear and goal-directed, someone who looks okay, but that doesn't mean that's going to be the case tomorrow. And this is why, this is why as clinicians, it's so important that we safety plan. When I work with women with postpartum depression, I actually have a current case right now. Safety planning is so important, helping the woman identify what are these triggers? What are the dangerous, intrusive thoughts? And getting the family on board with, hey, something is wrong. Don't leave her alone with the kids. We need to be checking on her. Here are the things we want to be looking for when we want to take her to a hospital, and really looking at suicidality on a daily basis and going over that. When educating the family and the client, when do I need to worry? With mental illness, a lot of times people have a baseline of what we call passive suicidality, meaning they don't want to take their lives, but they'd be okay if, they went to sleep and didn't wake up. And what that tells us is that they don't want to die. They're just exhausted from living the way they've been living. They don't want to be in that reality anymore. And when we worry is when that becomes more action-oriented, when they develop a plan, when they start getting access to means to the plan. So if, when it goes from, I just don't want to be here anymore, to maybe I should take pills, and I have some pills in my medicine cabinet, when would be the best time to do that? That's when we really start to worry. But here's the other piece is with mental illness, sometimes that can be a very impulsive decision. It can happen within minutes based off the level of intrusive thoughts. And what we know from this case is she was having a lot of intrusive thoughts.
What about triggers?
Being in that home environment, it sounds like, was a huge trigger. It seems like so I was listening to some testimony, and so I don't want to say resentful because it was said, no, she wasn't resentful. But we've also got journal entries showing that she's a bit resentful, if we just look at the wording, towards her other children, because she feels that she can't parent the infant like her first child.
This is why I say that you're kind of damned if you do, damned if you don't with the jury. And because even if it's split down the middle, 6 of them believe that, they feel sorry for her, right? They, oh my God, what is she, what she must have been going through kind of thing. And then the other 6 are probably saying, well, you know what? Screw her because she killed 3 kids. And I'm not trying to be, mean about that. I'm just saying that there are some people out there that feel that way, that, they're on the side of the kids and they don't care about her diagnosis. And they believe that she did this, willfully.
I cannot imagine being a juror in that case and having to listen to graphic testimony and be the one deciding, was this premeditated? Did she do this knowingly? Or was she in a state where she wasn't mentally capable of understanding her actions? And the defense...
Man, I would have stuck, if I was her defense team, I would have stuck or stacked that jury with clinicians.
Right?
I would have.
Yeah,
I mean,
absolutely.
I would have probably got striked so many times from the state, but it's worth a shot.
I think her defense has done a great job of bringing trauma-informed care and her mental health into this case and presenting it.
I agree.
Her attorney's done a great job. Being a juror on that case, I could not imagine the amount of weight they feel when they...
I can't imagine it either. I do feel that because of the awareness of mental health, and as I've always preached here on this podcast, we are huge mental health advocates, because I've seen from family members, the hurt, the damage, all that comes along with it, and then what's left behind, kind of thing, and for people to deal with, even after that person's gone. So I get it, and it's not because you, as knowing that person your whole life kind of thing, know that they weren't the way they were towards the end, if you will. It's not, it's not a fair assessment to say that they were crazy or they were whatever, that title that people love throwing around. But they were truly going through something, and we're advocates for that. We don't want to label people crazy without knowing the facts, right? We shouldn't call them crazy anyway. We should just say that they're suffering from mental health issues. I feel for her. Let's just say that if she really didn't know what she was doing, and she's now being told what she's done, or obviously she has been told, imagining that she did this to her own kids. She's already living in hell right now, in her own shoes. So I don't know what's worse. In other words, she's already convicted in here herself. So I don't know that 12 men and women could do anything worse to her if she truly didn't do this on purpose.
Right. This just, again, and this is opinion, based off of all the testimony we've seen, is this is a mother who loved her children, but was highly anxious and experiencing a severe mental health crisis. The prosecution is bringing in little snapshots of, clinical documentation, which, let me tell you, isn't always accurate, especially in settings where you're giving a social worker 16 clients at the same time and expecting them to document for insurance standards. We're looking at just these snapshots, and the prosecution is asking us to really come to the conclusion that, look, they said she was fine. She chose to do this. My opinion is that this is someone who is in severe distress and made an impulsive decision based off something that was not based in reality. If she was hearing those voices telling her to do something, she truly believed that if she didn't, her kids were going to be in danger. And we see that a lot with these command hallucinations, where they're so strong that the person truly believes, if I don't do this thing, it's not going to be okay. This is the better solution, to do this thing. She was, from all accounts, she was a phenomenal mother. It makes no sense why she would, in her right mind, do this.
Right.
And, you brought up a point that I want to touch on, and it's really sad, is looking at her at that worst moment and judging her. One of the saddest things I saw in this case was the nanny when she testified. And she said, Lindsay is someone I used to love. So judging her after giving testimony that she was a phenomenal mother, a loving mother, that this one act, and I'll give you a horrendous act that took the lives of 3 children. But I used to love her.
Wow. How many more Lindsays are there out there?
There's a lot. There's a lot that I think we don't hear about. There was a case a few months ago here in the Valley of Los Angeles that I don't believe ever made national news. A mother suffering from postpartum. Her family didn't know because she was high functioning and presented well, which again is not an indicator, because some people with psychosis can present well, but their reality is not, their thinking's not based in reality. This woman killed her 2 children, her husband, and then herself. An entire family was annihilated due to postpartum psychosis. They knew she was struggling a little bit, but they had no clue what she was going through.
Well, I am thinking that the final outcome of this is going to be a hung jury.
I agree.
And they're either going to have to choose to retry it, or I don't know. I just don't think this is the end of it.
Her defense has done a phenomenal job of creating reasonable doubt. And again, my opinion, I think she wasn't. And she wasn't mentally, her mental capacity at the time, she can't be held responsible. I think she was someone who was in a psychosis, presented well, and made an impulsive decision. And I know someone would say, oh, it's not impulsive. She sent him out of the house. This plan could have started hours before, when I say impulsive. And it could have come from a place of, this is what I have to do to save my family, to save my children, to make sure that they're okay.
Yeah. And, I think they're missing the point of what impulsive really means. It could have been legitimate reason for going out, running some errands or whatever. I don't know, but I just, like I said, I'm on the fence on that, because if she really did do it, then I'll have certain feelings about that. But again, I they've done a great job focusing on the medicine. I will say that. And if if you're impaired that way, or if these things are making you imagine things or to hear things or what have you.
And I'm so hesitant to speak on the medication piece, because as a clinician, one thing we know is that clients often don't adhere to what's prescribed to them. They will, we call it medication compliant. And we saw with the Zoloft, she was prescribed the Zoloft, but didn't take it. So we don't really know what she was doing with her medications.
Right. We don't.
Was she, a lot of times patients will create their own regimen, like, oh, I think these will work. So, I mean, I think if she was doing that, there's a strong argument that she maybe put some things together that a doctor wouldn't have.
Yeah. Just the other day, my doctor told me to stop taking one particular medication, which was a pain reliever. He goes, I'm giving you something else, so whatever you do, don't take that other one with this. I said, why? That's scary. And he says, it'll just be bad. He goes, just don't do it. That was all I needed to hear from him. It was like, okay. But it was like, basically he was saying it would have destroyed my stomach. So don't put them together. I'm like, okay. But see, something like that, yeah, I get the point.
And with mental health drugs, what we know as clinicians, and even from commercials where we hear antidepressants say, there's an increased suicide risk. So if she was taking these meds, what happens is you get dopamine back. You get the physical ability back before the depressive, intrusive thoughts have gone away. So she may have had the dopamine to commit. I don't want to say commit, that's a bad word. She may have had the physical ability, but not the cognitive or mental capacity. So when someone is on an antidepressant and they start physically feeling better, but they're still having those suicidal thoughts, they're more likely to follow through on it because they have the physical energy to do it. And that's what's so dangerous in the very beginning with someone, until their mind and those intrusive thoughts catch up where they have decreased. But that's why when you start an antidepressant, the suicide risk is increased, because if you're having those thoughts prior to the antidepressant, you don't have the energy to follow through. Once you're on the antidepressant and it's at a therapeutic level, you do have the energy to follow through.
Lindsay, to everyone listening out there right now, today, and in the future, what do we need to look out for if someone we know, someone we love, someone we care about is in this kind of distress? What do we do?
Offer as much support as you can. And a lot of times, this isn't a clinical term, but mom guilt. Due to mom guilt and fear of judgment, you're not going to have a woman tell you I'm in distress. And so family members aren't going to know. So what you want to look at is, does the person look tired? Are they eating? Have they lost weight, gained weight? Mm-hmm. Is there something just off about them? Do they not seem themselves? Are they easily distractible? Can they engage in conversation with you? Really just looking at the person and just looking at those factors of, just as a human being, do they look okay? And sometimes they do. So it's hard to tell. But if you do notice anything, even if it's small, bring it up, keep an eye on it. Let the other support system know other people in the support system know, like, hey, I have a concern about this. Let's keep an eye on it.
What about calling somebody, a professional?
So definitely a lot of times people are hesitant to reach out for help. It was brought up in this case that she was worried that her children would be taken from her if they knew the amount of distress she was in. Mm-hmm. So I just want women to know that that's, very rarely the case is that going to happen, that your kids are going to be taken from you because you're in mental distress, especially when you have a support system. And another resource I want to bring to people without great support, or even if they have support systems, is 1-833-TLC-MAMA. And it is the hotline for maternal mental health. And there's also texting or calling 988, which is help for suicide, mental health crisis. But I always recommend reaching out to someone who is specialized in postpartum depression and maternal mental health. Mm-hmm. They're going to look for that specialization, and that's important to have that specialization. But they're going to understand what you're going through and be able to help.
How can people reach you, Lindsay?
People can reach me at my website, which is 𝗏𝗏𝗡𝗏, or email me at lindsay@𝗏𝗏𝗡𝗏. Email is the best way to get a hold of me. I would encourage anyone struggling to reach out. I'm happy to provide even resources for you. If we can prevent one tragedy from occurring, that's a win. So if you're struggling or know someone who's struggling, send me an email. I'll get back with you and we'll game plan. How do we help your loved one?
Ladies and gentlemen, Lindsay DWYER-TONG. Lindsay, thank you so very much for this very special episode. Wish we didn't have to have it under these circumstances, right? But it's something that's very real and something that a lot of folks are living with. So it was important and it was crucial. I can't thank you enough for your expertise and your insight on all of this.
Well, I'm very grateful you had me today, and I always love being on your podcast. And I'm really happy to be here to speak about this topic. It is not spoken about enough, and we need to normalize this. We really need to destigmatize this. That's the only way that women are going to really start talking about it, and it's not going to be a taboo subject. And as long as something's taboo, it's not going to be treated.
Well, we absolutely love having you on this show, and we're going to keep having you on because we love you that much. And folks, if you see something, say something. These are your loved ones. These are people you care about. So what? Maybe they get mad at you, but at least you're trying to help them. Like you said earlier, Lindsay, if you can save one life or prevent somebody from a huge tragedy, then it's all worth it. All right.
Yeah.
Ladies and gentlemen, Lindsay DWYER-TONG. Lindsay, God bless you. And we will definitely be talking to you soon.
Thank you.